been doing and continue to do. We're so grateful and honored for you to sort of, to be here and to be able to this is Tigerlily. This is, this is a promise that you made to God, and it has come so far. And we're just really grateful for you being 15 years cancer-free, and for the lives that have been able to be impacted by your voice and your story and sharing your stories. And we are here to continue to do that, to hear other stories, and to be able to really work towards action, policy action. You were able to make a change with speaking with Debbie Wasserman Schultz, and we are hoping to do the same and continue to do the same, because there are so many advocates that are doing this phenomenal work, and we have them on with us today. I'd like to introduce Aleena Clavell.
Oh, can I jump in? So Aleena,
please, sure, go ahead.
Before you jump in, Aleena is very special to me. I met her years ago, and I mentioned the PALS bill that we got passed in Congress. I think Aleena flew out for that. She had just gotten diagnosed, and a friend of mine knew a friend of hers, and we met through social media. And when I talk about the power we have to make a difference, when I reached out to her, she at first was like, why did you, I can do this, and we talked, and she came to Capitol Hill, and we had 70 meetings that day, 70 meetings on the Capitol Hill with patients who are metastatic, and they walked the halls talking to people in Congress and sharing their stories and why it's important to raise funds for MBC research. And the power is that it's just, these stories are so important. And, you always think, I thought at first, I'm just little me, like, how can I do this thing or these things? And then if one person shows up and the next person shows up, together we are so mighty. We can make a mighty change. So I am so personally honored to have Aleena on this panel today, and I'm blessed to know you and look forward to having the others on this virtual stage meet you and hear your story as well.
Thank you. Yes. Thank you, Mema. And yes, thank you, Aleena, for being here. There we go. There she is.
There we go.
Yeah. Okay. Great. Yeah, Aleena, if you could, yes, please introduce yourself, and then we're going to have Vera and Diane as well share.
Good morning, everyone. I'm Elena Clavell, and I'm a almost 6-year cancer survivor now at this point. And do you want me to share my bio? Sorry.
Oh, sure. I can put it in the background. Yeah.
Like Mema said, I did meet her in 2015, and it was such an amazing experience because I literally left chemo to get on a flight to go out there. So I was in active treatment. And I think when speaking to our leaders, our congresswomen and men, it was so important to me because I looked like a cancer patient. So most of the time you see people out of treatment and in their healing phase, and I had no hair. I was still feeling weak. So thank you so much for that experience, Mema. And I was diagnosed back in 2015, and I was one of those patients that was told that I didn't have cancer, that they didn't think I had cancer, even after an ultrasound. So they were trying to send me home for another 6 months. And he's like, just waiting to see if it changes in size or shape. And just knowing the type of person I am, I worry about everything. And so that's just something I couldn't do. And I opted for a biopsy. But I think that's what's so important about being an advocate and teaching other women that it is okay to fight for themselves. I know my bio's up, so I won't actually go over everything, but I think that's just the main point of advocacy, and that I like to preach, and I like that information to be known, because if I had came back five or 6 months later, who knows what would have happened, just like Mema said. But thank you for having me, and I look forward to talking to you all.
Thank you so much, Aleena. Thank you. We're so grateful for you here with us. We're going to also have Vera Morris, if you could just introduce yourself, please, and share your story.
Good morning. Can you see me? Oh.
Yes, we can see you.
Thank you. Good morning, and I really do appreciate you having me here. Mema, you are such an inspiration to me. I love Tigerlily Foundation. Actually, Nani Reese is the biggest piece to why I'm here. She loved this organization, and who I am is I'm a current title holder, and I feel like using that crown as my megaphone has opened up so many doors. And it's the reason why I met Nani. I was listening at her speak, and I pinged her and I said, oh my God, you're amazing. And then we just had this amazing friendship. And everything that she taught me was to use my voice. And that is exactly what I've done. For me, I've lost way too many women in my life, and they've all been young, a lot of young women. So as an advocate, it's so important for me to really focus on those young adult women and women of color, because here in North Carolina, the mortality rate is just as high as the national rate. And I really want to put a dent in that and really put a dent in that late detection. And it's so important to really go out there and talk about education. And I say bridge the gap between that patient and doctor, and really be an advocate for yourself and ask the important questions. So that's what I'm here for. I'm here to gain more knowledge so I can take that knowledge that I have and continue to pass it on to others through my blog. In just a short few months, I'm going to start a Facebook series where we're going to have these open discussions. So it's very important, and I am more than honored to be here. So thank you so much.
Thank you, Vera. Thank you. And last but not least, Diane Nathaniel.
Good morning, everyone. I am so humbled. I was added like 24 hours ago. And I make time for advocacy. Anyone asks me, I'm here for it. I am a stage 3 colon cancer survivor, and I was actually misdiagnosed for probably 1 entire year before having rectal bleeding be the late stage indicator. And again, like all of us that has stated, felt misheard, unheard, dismissed in my complaints or concerns about changes that were actually happening to my body, and took it upon myself to say, after being diagnosed and having to go through major surgery, removing a portion of my colon, 12 rounds of chemo, and long-term side effects like infertility, right? I was 44 when I was diagnosed, and the screening age at that time was 50. And I'm thinking, where is the signage? Where are the messages that say, if you have these symptoms, please go see a GI physician? In fact, what is a GI physician? So I wrote the CDC saying, like, where are you getting these baselines from? Because if the screening age is 50 and I'm 44 in late stage, that can't be right. And I received a letter from President Obama and Joe Biden saying, hey, we're going to make Colon Cancer Awareness Month in March, and we thank you for sharing your story, and please continue fighting. And so that is why I'm continuing in advocacy. I created What We Didn't See in Beat Stage 3, and that is also making sure that we grab back our internal and external physical appearance, but our mental, our physical, emotional distress that we go through being diagnosed with this disease, and helping others go on to not just lobby in Congress, but starting grassroots work in our neighborhoods. That's where it begins, just educating and building health literacy with our own people, because we are dying at a disproportionate rate than every other ethnicity. This is the second leading cause of death, cancer death in Black people, colorectal cancer. So just wanting to make sure that we close that disparity gap by educating. So I am here for it, and I am so proud of this organization and glad that you asked me to be here today. Thank you.
We are so glad to have you here, Diane. And Diane also is being honored by her students for Women's History Month. So shout out to your class as well for honoring you, and we honor you, and just thank you for your presence here. I'm just going to share really quickly. I'm going to ask Julia Mawes, who is the co-founder of GRASP, one of our partners, to please just share a little bit about GRASP. Sorry about that. And then we'll go to our keynote speakers. Thank you.
Hi, everyone. It's a pleasure to be here. It's an honor, really, to be partnering with Tigerlily on Pull Up a Seat. What we're doing is we're bringing a model that this organization that Christine Hodgson and I founded follows. And it is really from the idea that patients are experts in living with cancer. So patients should be at the table making decisions every step of the way from the very beginning. So what you can see here is a walkthrough of posters at a scientific conference, the San Antonio Symposium. And a lot of the people walking around are patients, and some of them are scientists. And the idea is that all of them are experts, and together, by exchanging their knowledge and ideas and talking, then they really can advance research further. And what we did with Pull Up a Seat is we brought this model to Tigerlily, and with their expertise in disparities and all the impact that they've made over the years, we are highlighting the Black patient with cancer as the expert in living with cancer while Black. And we all know there are very unique aspects of that experience. We live in a world with systemic racism, and we live in a world where people aren't giving the same chance. So we're here to talk about those difficult conversations. And you'll be sent into small groups, and you'll get to hear from these women, which are, and they are the experts in living with cancer as a Black woman.
Thank you, Julia. And thank you for grasping a partner in this on this journey. Now I'm going to introduce our one of our keynote speakers, Leah Barros. Leah Barros is an experienced, pardon me. Leah Barros is an experienced lobbyist with a strong history advocating on healthcare, privacy, and civil rights issues. She drives successful advocacy strategies for her clients at the California State Capitol and tackles complex issues with thorough policy analysis and powerful coalition building. Leah credits her unique approach to advancing clients' policy goals and strengthening their political brands to her experience working in the Assembly as both a Capitol legislative and local district staffer. Among her most notable wins was leading the lobbying effort to enact the Creating a Respectful and Open World for Natural Hair Act, the first statewide law in the country to prohibit racial discrimination on the basis of natural hairstyles in the workplace and schools. A summa cum laude graduate from California State University, Sacramento, Leah holds a bachelor's degree in child development and a master's in social work with an emphasis in social welfare policy. Leah serves on the board of directors for the Institute of Governmental Advocates. Leah, thank you for being here.
Thank you so much. I really appreciate this invitation and the opportunity to speak to you all today. Before we get into the nitty-gritty of the importance of patient advocacy, I want to start with a short story about how I got into politics. And I want to do that because it weaves into my larger message on the importance of patient advocacy as a whole. So my pathway into politics was different than most. I didn't go to school to be I didn't do political science. I didn't do public policy. I went to college to become a child therapist. So I got my undergrad in child development, my master's in social work. I was on the path to the clinical life. My first semester that I was in the master's in social work program, I had two very pivotal moments that kind of happened to me. The first one was that I took a policy course, and the professor just absolutely blew my mind. And she had this beautiful way of talking about how practice informs policy and policy informs practice. And I want you guys to remember that because it's very important. Practice informs policy and policy informs practice. She also had this great way of just kind of talking about how we needed people with a holistic worldview and higher level policy decision-making positions. The second pivotal moment that happened was that my first internship that I had in this program, it was at a community mental health agency that served the homeless community. And I don't know why they would place a first semester student in an internship like this, but that's where I found myself. And as I was there, I noticed that there were so many issues. First, starting with the eligibility process. So potential clients, in order to become eligible for housing and mental health services, They had to wait outside at starting 4 or 5 o'clock in the morning in order to just have a chance of being seen that day by a practitioner. Not a guarantee, just for a chance to be seen. If they were successful and they were able to come in and go through the process, first they had to fill out a ton of paperwork. They had to wait for another hour or so in the lobby. Then they had to do this very long and arduous assessment. This assessment called the biopsychosocial. So you're asking questions about their biology, their psychology, where they are socially in the world. And guess who was doing the interviewing for this? Me. First year, first semester, social work student. These interviews lasted probably for about 2 hours, and I'm super green. Remember, like at this point, first semester, so I didn't know anything about anything. But there I was asking deeply personal questions about childhood trauma and drug abuse and assault, molestation. They're telling me stories about their parents selling them off to drug dealers and all kinds of things. Like you name it, I pretty much heard it. It was very uncomfortable for me, and you can just imagine what that must have been like for them. So they're operating in this space where they're having to deal with so many life issues, and then they go in to get services, and here's this young chick getting all up in their business who doesn't even know anything. Like what, there's a disconnect there, right? So that was very problematic for me. And what was made abundantly clear was that the people crafting the policy that informed how the eligibility requirements were created had no idea how it would play out in the real world. And this is the perfect example of what my policy professor instilled in us. Policy informs practice, and practice informs policy. It was after this experience that I knew that I was meant to become an advocate, because you have to tie in real world and policy implications. So how does this all tie into patient advocacy? The most simplistic answer is that people don't know what they don't know. So we have to break it down in such a way where they can understand the impact of these laws that they're crafting and passing, of all of the things that they're doing from this high level, because you can make all of these high level choices, but if you don't know what's going down on the front lines, it's often going to have unintended consequences. So my biggest thing for patient advocacy, and why I feel it's very important, is because there is this unique power of storytelling, right? Legislators and staff need to hear your stories. It helps them to visualize the impact of the current law that's in place, or maybe just to understand the unintended consequences, like I said, of proposed legislation that's going through the process. For me, sharing a lived experience is the most powerful tool that an advocate has. And I use that all the time as a lobbyist when I have bills that are going through committee. I'm always trying to get somebody who can tell a story. So an example of this, a bill that I worked on like back in 2016, AB 1795, probably one of my proudest moments. This bill, it was to close the gaps in the breast. There's a program that we have in California called the Breast and Cervical Cancer Treatment Program, and it serves underinsured and uninsured women. And there was this crazy provision in the program that denied coverage to a patient who was re-diagnosed with the same cancer at the original site. So how this played out was that if a patient recovered from stage 2 cancer in the left breast, and the cancer recurred same stage or same breast, then coverage would be denied. But if the cancer returned at a different stage or a different location, then it was covered. So fortunately, we were successful in closing that loophole and getting the bill enacted into law. But I will say that the biggest part was having patient advocates like yourselves. They took time to come to the Capitol for a day of legislative visits to tell their story. And they were really able to make it so that people understood what it meant. Because when you're just looking at bill language, it's legal mumbo jumbo. But when you're able to create a story surrounding it and make it so that people not only understand the issue, but that they feel the issue, that's what's the biggest impact. So I just want to say thank you all for taking the time to be here today and to learn about advocacy and the importance of it. As a lobbyist, I'm sure you can understand, just based on what you know of lobbying, that there's a lot of protecting business interests that we do. You know, big corporations, they invest a lot of money in having lobbyists. You know, you have, you know, some social justice organizations like NAACP and ACLU, but having organizations like Tigerlily to really invest in shoring up patient advocacy and having events like this, it's huge because the system isn't changing. And we need to have more organizations who are doing this frontlines kind of work, having a voice at their state capitals and on the federal level. So continue to show up and show out, always allow your voice to be heard, and do your thing. Thank you.
Thank you, Leah. Thank you so much. There's some questions and comments in the chat, and so we'll definitely address those after we hear from Michael Williams. So I'm going to pass it over to him now. And Michael, if you could just introduce yourself, and yes, please share us about your work. Thank you.
Great, thank you guys. Thank you, Leah. That was great. From the perspective, I'm the legislative director for Congresswoman Lucy McBath, who represents the 6th District of Georgia, which is the northern suburbs of Atlanta. And what Leah touched on, I think, was fantastic from a staff and a legislating point of view. Getting your story out there, what you guys are doing now, letting staff and legislators know that the things that we're passing into law, the things that we're considering, have real folks behind them, have real stories behind them, have real consequences. That's key for us to be able to be good legislators and pass good policy. So I just really want to thank Leah for pointing those things out. A lot of you may not know very much about my boss. My boss got into politics because of a tragedy. Her son was murdered over loud music in Jacksonville, Florida, and she became a gun rights advocate, gun violence prevention advocate, and then eventually ran for Congress. But one thing that a lot of folks don't know about my boss is that she is a 2-time breast cancer survivor. And this issue of health disparities of Black women, especially getting subpar treatment, subpar care, it's really close to home for her. And she spent a lot of time working with her colleagues to shore up gaps in policy, gaps in the way that we treat and we think about cancers for African Americans and other marginalized communities. You know, your advocacy means a lot. You know, I think it's an underrated aspect of what we do. A lot of what we do is meeting with constituents and better understanding how the policy affects you. You know, as her legislative director, I am responsible for executing her legislative priorities. And like I said, you know, the way that we come up with those priorities is through the things that we get from our constituents. And, you know, our constituents come to us through organizations like Tigerlily, through organizations like Black Mothers Matter. Those are the kinds of organizations that come to us that tell us on the ground what's happening and how we can fix it. And I think, you know, Lee also touched on that in a really concrete way. You know, at the end of the day, these policies are enacted one person to another person. And in order for us to make the best policy possible, we need to know what's happening in that interaction between those two people and how we can remove any sort of barriers to delivering that service in a way that's culturally competent, that takes into account the complexities of people's situations. And I think advocacy is key to that. And I know that we're running a little bit behind schedule, so I kind of wanted to wrap up with saying, you know, I think that it is vitally important that you guys continue to reach out to your congresspeople, whether at the state level, at the federal level, and reach out to your city council people at the local level, because without your voices, without the things that you say, we really are kind of just swimming in an ocean of information. You know, it's all legalese until an advocate comes in and tells us their story, and then it becomes a real concrete thing. So with that, I'll turn it back over to Shonda, and we can move to the Q&A.
Thank you, Michael. Thanks. Thank you so much for joining us, and thank you, Leah, as well. Quickly, before we move into the Q&A, I wondered if you could just touch on the More Health Education Act and the Maternal Health Caucus.
Yeah, of course. Yeah. So the Congresswoman introduced the More Health Education Act, which would put a bunch of funding in place for people to sign up through the Affordable Care Act exchanges. And then she's also a founding member of the Black Maternal Health Caucus, which has a large bill that we call the Momnibus. It's with her, Alma Adams, and Lauren Underwood. And that looks to address a whole series of maternal health issues with a focus on lowering the rate of Black maternal health deaths. And one of our bills in that larger package, it's called the Social Determinants for Moms Act. And so, those are like a couple of the things that we're really focused on. But, we also have the CDC in our district. So we've been doing a lot of things with trying to expand programs that do surveillance and public health work in communities of color. And then we've also been working with Emory to try to get them funding to do culturally competent clinical trials and diversify their clinical trials. So those are kind of some of the things that we're focused on. And, I'm interested to hear, what we're missing, because there's always things that we're missing.
Thanks, Michael. I have a question from you from the audience from Sanford James, who's asking, how can recent voter suppression laws be addressed when clearly it will impact the health of women of color and rural communities?
Yeah, so thank you, Sanford. I think that this gets to a really important point, right? That there are downstream effects to these kind of larger systemic racial issues that we have in this country, and especially in Georgia with the recent it was signed into law, the voter restriction bills. We have a bill in the House of Representatives that's passed out of the House of Representatives that's been sent over to the Senate, HR 1, which would undo a lot of those voter suppression laws. It would basically, for federal elections, it would undo all of the things that they just passed into law. However, I think what you're touching on is how removing representation in your government creates bad policy, because the representatives are picking their voters rather than the voters picking their representatives, and the downstream effects of that end up to disproportionately hurt Black communities, women, rural communities. And so I think continuing to put pressure on whoever your representative is, letting them know that you exist and you matter and you're one of their constituents. I think that's very helpful towards remedying some of those issues. But ultimately, when you start to look at systemic voter suppression, I mean, that can really only be remedied by opening up and having free and fair elections. And so that's something that is the number one priority for Democrats. It's HR 1, and it's going to continue to be something that we fight for.
Thanks, Michael. And a question for Leah. Does the breast cervical program that you mentioned in California, does it address treatments and reconstruction if needed or desired?
I don't know specifically. I know they do cover like durable medical equipment, like prosthetic bras and stuff like that, but I don't know specifically about that type of eligibility. But they have a very comprehensive website if you wanted to look it up, or maybe even call and talk to somebody directly.
Okay, thank you. Thank you both. So I'm just going to share my screen. We're going to ask our patient experts to please put their cameras back on as well. We are now going to switch to breakout rooms. So we're going to have our patient experts are going to be going into these breakout rooms, and they're going to have conversations with healthcare professionals. And our keynote speakers, if you can stay, we're going to stay in the main room and have our own conversation with advocates. So I'm going to ask so just please hold tight as we populate and move around. While we're doing that, one of the comments for Leah was someone just wrote, Sanford said, "Thank you for responding. I'm in favor of some coverage for treatment as well as screenings." Yeah, and also another comment was that, about related to, regarding the cancer treatment question, I think that we do have someone, Lizzie Witeg, who's a part of Tigerlily, so that she can provide a little bit of information on that. So Lizzie, if you wanted to pop on or just share those details while we're going to our breakout rooms, please.
Yeah, thanks, Leah. I was lucky enough to get to work with Leah on AB 1795 in California, and there is the screening and diagnostic part of the program, and then the sister program does treatment. And so treatment is available for people going through that program who are diagnosed through that program, or who are diagnosed outside of it and are underinsured or uninsured. And it covers reconstruction as part of the treatment. But if it's a reconstruction decision later, after, some people don't decide to have reconstruction for a while, it's not currently covered. So that is still one issue here that we're looking at, but there were 3 loopholes that actually were addressed. So thank you again, Leah, for all your work on that and the change in the policy here.
Thanks, Lizzie, for sharing that. And I hope that answers gives some clarification on that as well. So yes, we're going to be sent out in the breakout rooms. Those who are going to stay here, we're going to continue our conversation. If you have more questions for Leah and Michael, they're going to be on for a little bit longer. And so while we are getting that situated, I wanted to, I guess, to hear a little bit more as well, Leah, that you're mentioning about some of these screenings that are taking place, or the work that you've done. How can patient advocates, if you could just say sort of a step-by-step, yes, sharing your storytelling is important. How can we also, what next? Like if we were to work as a collective, how can we, really make an impact? Are there specific acts or legislation that you think that would be really important for us to sort of mobilize and move towards trying to address? If you have, and this is for both of you and Michael.
So I would say like the most important thing that you can do is build relationships with your local legislators, right? So go to their district office, introduce yourself, and make sure that they know your name and what's important to them, and what's important to the constituency, right? So you can do district office visits, you can do legislative office visits if you live in a capital city. Take part in lobby days. So if you're part of any organizations that do lobby days at the state capitals or on the federal level, that's very impactful. Letter writing campaigns, emails, social media pushes, all of that helps with advocacy. Shameless plug, I would also say if you have like a coalition that you're a part of, and you can be like dues paying coalition members and pool up some money to hire a lobbyist, that's probably the strongest thing that you can do, because then that lobbyist will track all of the legislation that's going through the political process for you to let you know what you can weigh in on to support or oppose. So then you're really impacting what passes. You're killing bills. You're making sure bills are getting signed into law. If you have any bill ideas, then you can put those bill ideas forward and try to find a legislator to author it and have it, go through the legislative process. But if you're not in the position to be able to get people together to hire a lobbyist, you still have access to your members, right? They're there for you, right? And I think a lot of people get intimidated by capitals because they're these big, powerful buildings, but it's the people's house. Like, you belong there. So
Right.
Get comfortable with it.
Yeah. Michael, do you have anything to add to that?
No, she's right. It is the people's house. It's your house. You have every right to talk to your representative or staff for your representative, and you should exercise that right. I mean, I'm a firm believer that people should engage with the process. I think it doesn't always work the way it should, but I mean, it's a lot better when we're hearing from real people as opposed to just business interests or the people whoever can hire the most well-connected folks who everybody knows. I think the power of the constituent is very underrated. Like, right, if you're a constituent, you can always get a meeting with our office, no matter what. Like, one of us will meet you, and so I think she's absolutely right. I mean, if you can pull together your resources and get a lobbyist, then that's always better. But if you can convince key staffers that your idea is a good idea, or that this bill needs to be killed, or this bill needs to be introduced, you can go pretty far just through direct contact with the staff.
So who are these key staffers?
and I guess it depends on the office.
Okay.
So for an individual office, like you would need me you would need the legislative director to sign off on your idea.
Okay.
On committee staff, committee staff has a lot of power. So committee staff decides what does and doesn't get brought up for a hearing, which decides what does and doesn't get brought up for a markup, which decides what doesn't make it to the floor. So if you can convince committee staff, you can pretty much, you can do anything. You can get it all the way through the process. But it's like an escalating thing, right? So if you can convince a member who's on the committee to convince committee staff to then talk to leadership, that's kind of the chain of command.
Okay. All right. Thank you. I had to get into the nitty gritty, so we have all of the tools that we need. So those who are listening in, yes, legislative staff, legislative director, committee staff, Stanford, yay, in the comments. What did he say? I believe an important missing ingredient today is a lack of engagement with the communities. Many persons are aware they can visit their representative's office, but I feel there needs to be more community visits to truly gain perspectives of grassroots events. Yeah, what are your thoughts on that too? Do you, I agree.
Yeah, I think it's been, I think that this year's been, obviously the last year's been very difficult on that front. My boss really likes to go out into the community, and she's a normal person. So she didn't plan on being a politician. It kind of happened to her. So, she is likes to get out in the community and meet the folks and see them and figure out, what's going on in their lives. But you're right. I think at Stanford, you're right that there are certain members who do not really engage with their constituents in that way. And a lot of times you have to force the issue with those folks.
And I would say I got my start working in politics for an assembly member in her district office. So I have district experience. And I would say the member I worked for was very engaged, and we got a lot of requests to go to community events. But if you're getting most of your requests from a certain kind of sub-community within the community, then that's what you're going to go to most. So I think it's also up to the constituency to make sure that your specific community is out there, and that you're sending invites to the elected officials to come to your events, because if they don't know what's going on, of course, they're not going to send anybody there. So that's another reason why it's important to build a relationship, because you can literally just go into the district office post-COVID, of course, and just hand deliver your invitations instead of emailing it, put a little bit of a personal touch to it, and then you're going to get a higher priority just from having built that relationship and taking the time to do so.
Thanks. And so in terms of, because of this, like you mentioned about COVID and the year that we've had, how have you, have organizations or legislators been able to actually go into the community? Since we haven't been able to do that, how's the virtual presence in terms of events or trying to, being able to connect that way?
Yeah, it's been a lot of virtual Zooms, big Zooms, teletown halls, Facebook Live town halls, things like that. I mean, it's just been, she can't go to the Veteran Service Organization and, see the work that they're doing. So, they'll get on a call with her and reach out to us that way. But, it has been a difficult year as far as getting a real feel for what's going on in the community, especially at the grassroots level.
Okay. Do we have any other questions? I see, Sam, that you're on video. Do you have a question or a comment?
I was actually wondering, do you have any tips for people who do not have a lot of legislative advocacy experience, but want to get into it now that we're in this Zoom world? It's really hard to make new connections with people that you don't know when it's virtual. So have you had any good experiences that you can speak to?
I would say the virtual thing is difficult because when you're going to these virtual events, it's, just everybody kind of in their respective squares, and it's hard to chime in and have little breakouts with somebody in the room that you want to meet. So I can't really speak to that. Like maybe what we're doing right now for advocating, as a lobbyist, is most of what we're doing is done via email, right, and virtual coffee. So if there's somebody on a virtual event like today, if there's somebody who speaks and whatever they're saying speaks to you, and you're like, I really want to know more about this, then get their information and shoot them an email and say, hey, are you down for a virtual coffee? I'd love to learn more about what you do, and just kind of let it snowball from there. And that's kind of how you would do it at an event. If I'm at a networking event or at a conference or something, and somebody speaks, or if there's somebody in the room that I want to get to know, I'm going to go up and start some small talk chit chat and get the business card and start building the relationship that way. But again, it's so much more difficult virtually. But if you're just a little scrappy, just get a little scrappy with it, and you can make it happen.
Thank you. Thanks for that. Do we have any other comments or questions? I see we have some people. I see Jamil, you're out in the audience. Roberta, we have some patient advocates. Do y'all have any questions for our speakers? If not, I will keep on asking. Okay, go Lizzie, go ahead.
I would just say, in advocacy training, we talk a lot about storytelling and making sure your personal story. I was wondering if either of you could share tips or personal experience stories about ways patient advocates were really effective in getting their thought and cause across and getting a legislator on board.
Yeah, so I would say when there's a certain issue that you're advocating for, to set those meetings, right? Talk to staff, try to get a meeting with the member if you can. I touched on this a little bit earlier, but lobby days are very effective because you have strength in numbers, and that kind of takes a little bit of the pressure off of any one person. You kind of go into as a big group, and you talk to a legislator or their staff, and you can either do it, or you can do it organically, where you just kind of have a large kind of I don't know what I'm trying to say here, but it's like a large just issue that you're advocating for. You can just go in there and say, okay, well, this is what we're advocating for. This is my experience. This is my experience. This is my experience. Or you can go into it more strategically, right? And say, this person is going to talk about their experience with this. Another person is going to pinch it, and they're going to come in, they're going to talk about this. So it really just depends on the issue. It's kind of hard to give advocacy advice in this way, because I'm very strategic about my approach. So, doing patient advocacy on this bill may be completely different than how I do it on another bill. So strength in numbers, lobby days. If you don't live in an area where you have an organization that does lobby days, again, it goes back to building that individual personal experience, and just making sure that you're talking to legislators and staff like they're regular people. I think when people go into the capitals or they have these meetings, they get kind of intimidated just because it's an elected official, but really they're just like you and me, right? And so if you just, look at their bio before you go into a meeting, if you have a meeting with the actual member, you can find information about them on the internet. Do a quick perusal. I'm sure you can find one thing that you have in common and use that to break the ice, right? And then once you do that, it becomes less of a formal kind of stuffy meeting, and it's more of a conversation. And I know just from my previous experience being a staffer, I appreciate that, because you're looking at, policy all day, and you're trying to parcel things out and make sense of it. So when you have somebody come in and it's just like, you're just having a conversation, it feels better, you understand it more, and it has a better touch to it.
Yeah, Leah is absolutely right. Yeah, treat us like normal people. It's so much better when we're just having a conversation like the way that we are right now. That it'll help us relax and not feel like we're the people who are in charge, and it'll help y'all relax and be able to tell your story in a way that feels genuine. I mean, the thing for me that I like the most when people are advocating is when I can tell that somebody's telling me like a true, genuine story, and that there's like real emotion and stakes behind it. And like, you know, I think that, you know, most groups are really good about sending those people. And I've become really close with some of the advocates from our district because, you know, well, we meet like 2 or 3 times a year, and like they tell me their story, I tell them my story, and like, you know, you get to know them. So like, you know, the Alzheimer's folks in our district we're really close with, you know, and so I think that you can start to kind of build that relationship to a point where it's not so formal feeling, and like, you know, you feel like you need to like pitch us on the numbers and like, this is why the numbers make sense. Like, it's really, and this is true about all of politics, it's really about vibes and feeling. Like, you know, it's not really, it's not about the other stuff. So yeah, I think that Leah's right on that.
I just want to say that was spot on, Michael. The vibes and feelings. That's like you really have got to get people to feel your position, to feel where you're coming from, to feel your experience. It makes all the difference in the world.
Mm-hmm.
That's so good. It's true, you know, it's so interesting because you think like you all have been saying that you have to come there with these numbers, but it's really what you're saying is be yourself and share your story, share your truth, and that goes a long way. And you know, I'm curious as well, like Lizzie was, you know, asking about patient advocates. I'm also curious just about each one of you, Leah and Michael. How did you get involved in this? Like, what's the passion behind it for you all? Because there has to be some kind of motivation. That
I don't know how this happened.
You just stumbled across it.
Yeah. So I was my undergrad was in biology, and I was going to get my PhD in genetics at Emory, and then I went to work in a genetics lab at Emory for, you know, I did it for 1.5 years, and I hated it. I absolutely hated it. And I was like, well, I've always liked politics. I'll move to DC, and so I moved to DC in the summer of 2016, and shortly thereafter, the 45th president was elected. And from there, I kind of was like, I need to get involved, and I've been here ever since. So that's kind of, yeah, that's kind of how it happened for me. You know, both my parents are healthcare practitioners, and so healthcare was kind of an obvious avenue in. So after I moved up to DC and like got an internship, I then applied to grad school. And then while I was working, I was going to grad school, getting my master's in public health and health policy.
Awesome.
And
How
so
about you, Leah?
Yeah, so for me, it all goes back to that that experience that I had at that internship. I just knew then and there that I had to answer that call and do something outside of what I thought I was going to be doing. And also just like the trajectory was, after I started taking more macro level policy courses, I changed all of my electives to do that. I took another professor who was very impactful, and she was on city council running for state assembly. And she was trying to get people to volunteer on her campaign. I volunteered a few times, would, you know, drive and precinct walk and volunteer and all that stuff. Did a campus fundraiser for her, raised $2,000, which is a lot of money for a campus college fundraiser. And at the end of it, she ended up winning her assembly seat. And I respected this woman so much, and she was just so amazing that I took her for like 3 classes. And so after she won her assembly seat, she says to me, well, you pretty much stalked me and took me for 3 classes. So I know you have stellar work product. You showed yourself to be very loyal to me by working on my campaign. So I want you to come and work for me when I, you know, start at the state assembly. And so I was just like, that ain't nothing but a word. You better believe I'll be there. That's how I got into it. And I naively thought that I would be working for her whole term. But what I didn't know is that there's not a lot of movement within one legislative office. And Michael can attest to this, you know, elected officials can be crazy. So going from like one member that like, she was amazing, we had a great vibe, and the thought of going into another member's office just to move up, but not really knowing how that would be, I wasn't down for that. So that's how I ended up going on the outside and started lobbying, as opposed to having a career just working, you know, in the building.
Very wise, Leah, very wise. You have to be careful about your bosses in this line of business, like, because they run your life. So, you know, you got to be really, really careful.
Yeah.
Oh, thank you. Thank you all for, yeah, just sharing about your path and drive and tenacity towards getting, taking the action to get there. And, you know, Michael, your healthcare background, and Leah, your, you know, just seeing how it works in like the community, seeing the grassroots level and seeing how you're able to make a difference and take actionable steps has really come through. And, you know, it's really great to see that as well. So do we have any other questions or comments before? I know that the breakout rooms, everyone's joining us back in like 15 seconds. I do want to thank you both. I know, Michael, you may have to hop at 12, so I appreciate you coming as well to be here. And yeah, this has been really great. And I think that there are a lot of takeaways that we can, from the gems that you guys have provided about what it takes, what's really important about being, you know, just sharing your story, being authentic, not being afraid to speak and go to these, you know, don't be afraid to go and speak to your representatives. They're people just like you. And, you know, it really makes a difference, and giving us some real tactical tools of what we can do, whether it's coming together as a collective, hiring a lobbyist like Leah to be strategic about it. You know, you don't have to go about the numbers. You can just share your story and connect. We learned about how to connect with the key people, legislative directors like Michael, and and committee staff. So, you know, it's really important, and we're really looking forward. For those who are on the call, we are going to create and sort of put this together as a guide to be able to share so that we can really move towards actionable steps. So now I would just like to open it up to our patient experts who have just joined us back, and those healthcare professionals who were a part of the breakout rooms. I'd like to ask each one of our patient experts to sort of share with the breakout room number 1. I'm not sure who is the patient expert for that, but I may just go by name. So I'm going to go with Aleena, A for Aleena. We're going to start alphabetically. Aleena, if you can just share about your breakout room and what you guys, some takeaways and that you guys had from there. Thank you.
Can you hear me? Can you hear me? I'm not sure. Yeah.
Yep, we can hear you.
Okay, so some takeaways. We were speaking about like clinical trials, and I kind of started a little bit later and a couple minutes later in the breakout room, but we were starting to get into a groove of talking about like how to communicate that the patient and like a professional relationship, and whether or not you can qualify for the clinical trial, and also like the background of the clinical trials, basically talking about like, you know, there's a large number of pages that go into it, or prompts that, you know, you have to have good, like lower blood pressure for this specific medication, or for this specific trial, or, you know, just making sure that they're in a safe clinical trial for them. And it's interesting to hear that, because when you're thinking of a clinical trial, you're thinking you're being put in there to figure out these things. But sometimes as a patient, you don't look at the whole big picture of it, and knowing that there's so many different clinical trials that they're trying to make sure that your health is always put first. Because you look at clinical as like being like the guinea pig, right? So it was nice to hear that, and to see that they do focus more on different backgrounds and different health concerns. So that was one of my takeaways from that. And thank you all for speaking with me.
Thank you, Aleena. Thank you so much for that. We're going to hear from Vera. How was your group?
Might want to unmute myself. Can you hear me now? Yes. So we had a great group, great discussion. Victoria and Beulah, thank you ladies for really speaking up a lot in the group. Victoria shared about a story of a young woman who was 22, who was diagnosed with breast cancer, and the doctor pretty much told her she couldn't do it. So we talked about different ways to really get it out there, and social media was the first thing that that popped up is that how we need to put great information on social media as our platform, because it's such a huge platform and people seem to listen to it. So if you put more information there, it will actually bring more awareness. Yes, we are stronger together. That is absolutely the truth. We also talked about, Beulah was talking about different photo shoots, you know, these young women, they're under 30. And I was saying, you know, as a woman of color, you need to see more of yourself. What I run into is if you don't see someone that looks like you don't think that you can get it. And that is such a myth and it's such a misconception, because anybody can get it. So I was saying, if we can just put more of those young adult women out there to really put themselves out there to share that story, it will really, you know, make people stop and think that, you know what, this can happen to me. I don't have to be older, not have to be white. It can be anybody that can get it. And we also talked about lobbying to DC. And, you know, Victoria, we were talking about how expensive that can be, but how great it is to have those virtual conversations with your legislators. But we will also inform the American Cancer Society can cover those expenses for you if you want to go to DC and lobby. So it was a great discussion, and I really do appreciate the opportunity to talk to these ladies.
Thanks, Vera. Thank you for that. These are some great tips. And yeah, like, you know, Jamil was writing that it should be required for legislators to receive ongoing education from patient advocates to gain understanding of the actual landscape versus coming in and making incremental changes. And, you know, it's also good to know that the American Cancer Society helps to cover expenses to DC. And, you know, I was writing here as well. I wrote in the comments about us being able to share our stories. There's so many platforms that are sharing our stories. How about we collect these stories all across these different platforms and bring them in one, whether it's putting them on the desk or what do we do? I don't know, even if it's a video, having different stories and collecting them. But I'm brainstorming here. Well, this is just the first step, y'all, because this is just the beginning of us coming together. Like Diane said, we are stronger together. And actually, I would like to turn it over to Diane to please share about your group and some of the advocacy work as well that you've been doing. Thank you.
Well, I actually shared out about a terrible healthcare experience I just literally had in these last 2 weeks. And just talking about patient advocacy also being you advocating for yourself and how when you're mistreated, you know, what to do next. Because a lot of patients are deterred from actually following up on a healthcare issue based on how the office responds. And so we talked about disparity being at the point of the phone call. Because if I call and you are absolutely nasty and your attitude sounds like my health is not going to be prioritized in a positive way, then most people won't follow up. Or if I've waited this long for this appointment and I've assigned childcare, I've taken off time from work, and then I come and I wait 2 hours for you to see me 15 minutes, right? And then, or I have to leave because I've waited 2 hours and now I've got to pick up my children. All these provisions that I find that the working family has to put in place just to make an appointment, and then to be mistreated by negative attitudes for whatever reason can really deter people from continuing on. And as we were ending, I was just sharing, I have a girlfriend who was diagnosed with breast cancer, but she was a principal. And she took so many days to go to these appointments and had to leave because they kept being so late. And then she was diagnosed, right? So, I mean, she wasn't going to go back, but something appeared. So how many people does this happen to in different forms of whatever healthcare they're seeking? And how that just creates further sickness among the community, and then you blame us for being sick. So just wanting folks to know, like, that I did some public shaming, as Christine was like, I love public shaming. So I did a 9-minute, 48-second video. Yes, I did, along with a nice little narrative about how I was mistreated this week. And now I'm writing a letter to the president of the hospital, because, you know, they hate to have any type of negative letter come into their office. And it's not about getting folks fired, losing a job, but if you're serving, especially this Caribbean, this African American community, There is no way you're going to tell me you didn't do this to other folks, especially with the immigrant population that's there. And if I was mistreated, I can only imagine. And they serve an elderly population. I even forgot to include that. So it's just unacceptable. So again, patient advocacy goes far beyond going to DC and lobbying before Congress. It really starts at the top in the institutions that are serving us. And we do have voice in who's serving us. And I don't think we see the medical field as like this upper echelon segregated community, but we have to work together and partner, and we have to tell. Most of us don't name it, right? This whole new thing that we're doing with being an anti-racist and having allies is about naming it, calling it out. And it's not always just the opposite, ethnicity doing the harm, right? That happens well within, because I got to tell you, it was a myriad of folks from different ethnicities that gave me this terrible experience. So I have a backup hospital. So I'm gonna write the letter about this one, but I still got my appointment on the other side. So looking forward to really partnering with everyone and hoping together we are stronger.
Call them out, call them out. So listen, yesterday, Diane, I told you guys that, call them out. But yes. Key point though, Diane also said she has a backup hospital, okay? You're gonna call them out, be strategic, and know you have backup plans, okay? Because your health is also very important. So please, it's really important to call them out and speak out, like you said, Diane. There seems to be this sort of invisible barrier between like healthcare and the patient, and this sort of, like you said, being this upper echelon, and it's like, oh, I don't really want to cross that line. But like we've heard on some of these previous pull up the seats, like the patient is paying you for a service. You're paying them, okay? So just like the same thing with legislators, they've been put there, the people have put you there. You have access to them. It's the same thing. You gotta like speak to them. We've heard on different calls before about how some of our previous patient experts have literally fired their doctors, not once, not twice, maybe 3 times, until you get the right person who actually understands you and sees you for who you are. So it's so important. And this is why like we have these conversations, to hear these stories, it's so unfortunate that we continue to have these, and these conversations are having to literally experience not just with those who are, like you said, aren't just our allies, but also within our own community as well. It occurs within our own community. So how do we, work towards this? But also, like, you have to sometimes call people out in order to really get them to see the impact, to address what they're doing, because sometimes people are just on autopilot and they're bringing their emotions from external stuff that has nothing to do with you. But you are there, you're a patient, you are you're just trying to live, okay? Like, this isn't the time for you to have to come and then have to deal on top of this with having to like anyone and their attitude. It's not the time. It really isn't. Sorry, now I'm gonna get off my soapbox, because Diane just took me there, because yesterday, yes. So all that to say, we just need to, like Jamil said, we all have our biases, we do, but it shouldn't impact the way that we receive care. It really shouldn't. And I hope that this is, the beginning, a continuation, because a lot of everyone on this call has been already doing so much work, speaking. The fact that you're on this call is an effort and an action that's being taken. Whether or not you have spoken, but you're listening, it's an action. To Aleena and Vera and Diane, sharing your stories and continuing to move forward. To Christine and Juliet, all those that are on who are dealing with these, either have survived or currently dealing with, this with cancer, and dealing with having this a daily challenge, and the lasting effects that come along with it. You're continuing to do it. We have to keep going and keep on pushing. And I'm really looking forward to us working together. As you see, Diane, she had colon cancer. She's a colon cancer survivor. Vera is an activist. She's an advocate. She dealt with Crohn's disease. Aleena, breast cancer survivor. So yes, we have to come across lines, because at the end of the day, it's about us getting treatment as human beings, and policy towards being seen as humans and being able to receive that coverage. Like Leah mentioned about these loopholes that are taking place. We had a conversation with Sean Johnson, who was on one of our previous calls, talking about the uninsured and Medicare and Medicaid and the loopholes there, and why the access, we aren't receiving the access to specific cancer treatment centers that have these like top-notch doctors. We're actually being put into a different category, places where we aren't able to get the care that we really need, and people are dying, especially within the brown and Black communities. It isn't fair, and it goes to the policy level. So Leah and Michael, I know Michael had a hop, but thank you for sharing the action steps, because right now the people on this call are taking a stand and saying that we're really going to come together across whatever diseases that we're dealing with, whatever that is, towards removing these disparities and removing these barriers. I'm going to stop my rant and open it up for other people who would like to share any feedback to the audience, to the speakers, or anything you want to share. Please, the floor is yours. Talk about it.
I did just want to mention, I am one of the advocates that goes to DC through American Cancer Society, Cancer Action Network. So what you need to do is become an advocate in your district to be sent. And I believe you have to be an ACT lead, which is an ambassador constituent team leader. So it's now you being the team leader for your district. And I got to tell you that when I go, it's out of maybe 600 folks, I'm probably 30 Black people. And from New York, probably 5 of us are of color. So, and out of colon cancer survivors, I'm the only one. Because either most people don't live, because we find it in late stage normally, right? With the GI cancers, they're silent killers. There's nothing like you can feel or detect other than getting your colonoscopy screening, which if you're 45 and on this call, please, I need you to do that. So definitely look it up and see if there's a representative in your district, and then please join forces with them. Again, stronger together.
And I just want to piggyback on that. Thank you for bringing that up, Diane, about the low numbers of Black folks in this advocacy space and taking part. It's such an untapped resource. Like, our voices, they're so powerful, and we have such a unique experience that it's important for us to show up at these events and to really create space where it's not open to us already, right? I think sometimes outreach in our community is lacking. So a lot of times we don't even know that these opportunities are available. So just making sure that, you're continuing to spread the word about the work that you're doing, talk to a friend, tell somebody about it. Everybody on here, I know you know somebody who you can reach out to and let them know, hey, I was on this super dope conference panel discussion today, and they talked about XYZ, and I think you should learn more because you have a great voice and a great story that you can share.
Yeah, absolutely. Do we have any other comments or questions or anything from the audience? Okay. All right, that's okay. Thank you all so much for holding space and for being here. This work is so important. And like Leah said, like Diane said, representation. If there are over 600 participants that are going for these days to DC and there are only 30 that are people of color, we have got to do something about this. And within our communities, we need to be able to have access to this. The resources are there. We just need to move forward with it. And so, Diane, thank you for being on this call, and definitely going to reach out to you. And also, as we we're going to put together a resource list so that we'll share this information about how to get in touch with your team leader, where to find this information, like how to contact Aleena, Vera, Leah, Diane, Christine, all of us that are a part of this, doing this work, to be able to see like how we can work together. So this is just the beginning. Continuing to roll up our sleeves and get it done. Leah, thank you so much for being here and for sharing. Thank you for the crown act. We were all out here doing it. Thank you, Leah. We appreciate you. Thanks for your work. Yes, curls are out and it's okay. So thank you. We're so appreciative of the work that you continue to do. Please continue to stay in touch as well with us. I don't, if for the panelists, please, if you can just drop in the chat your contact information so that those who are in the audience, if they'd like to reach out to you, whether it's through Instagram or Twitter or email, how they can reach and follow up with you. And I would just like to, yes, thank everyone again. We have this series, just to let you know, this is our Pull Up a Seat and series, conversation series. We have it on a monthly basis. Next month, we're going to be talking about diverse patient populations and their importance, the important role of diverse patient populations in research and education. So how are these populations being included in research for these articles and journals that are going out? And so we're going to have a conversation on that. So looking forward to, if you can, to join and continue to participate, to continue to learn. I hope that these conversations have touched you in some way, that you can go ahead and make a difference, like whether it's at your city council level, whether it's just sharing what you learned today with someone else, just taking a next step. It's really, that's all it is. It's just taking a next step. We each have a story to tell. Our voice matters. There's no one else in the world that'll ever have a voice like you, and it's, you have it for a reason. So please use it, share it. It is beautiful, and your story is beautiful, and just, yeah, thank you all so much. And I don't know if our patient experts and keynote would like to one or two things before we sit off today.
Yeah, I just want to say, when you're embarking on this journey of advocacy, don't feel like you have to be an expert. Don't feel like you have to have everything perfectly crafted. Just go in there, lead with authenticity, be okay with vulnerability, and allow your internal light to shine. That's what really touches on people. Sometimes we have to know that you got to go into something, building the car while you're driving it. And that's okay, because everything is a learning process, and you're always building upon the work that you've done before. So it's okay to not know everything.
I would add that your story is your story. No one can give you your experience. So when you walk in the room having had cancer or some experience of a disease that they have not, you are the expert. And I learned that going. They can't tell me about what I went through with chemotherapy or surgery or my experience in being misdiagnosed. No one can tell me that. And in order for any of it to change, like Leah has said, we really, really have to know and understand the power in our voice as patients. And everybody's going to be a patient one day. And I tell the congressman that you might have great insurance, but your illness or the sickness that you may succumb to doesn't matter what your insurance covers. You want to make sure you have the treatment that's going to bring you back to healthy. So you let them know we're 1 degree away from cancer. And if you guys didn't know anybody today, you met a few of us. We are now your 1 degrees. So make sure that when you're fighting, it's also for our children coming behind us, our parents, all the shoulders that we stand on that even allow us to be in the space in a legislative position, and know that the grassroots level is so much more important. President Obama, y'all, he got good because he was in people's houses on Sunday afternoon. It was grassroots work that really, really put him there. And while we know he's limited and everybody in that space is limited, from this part, like every action step that you take will be something toward changing this policy that's created to keep us excluded. So I want you to know the power of your voice.
All right, Vera or Elena, any? Okay.
I'm just gonna say, I'm just gonna keep fighting. You know me, me, my notebook of ideas, staying up all night, continuing to be involved in groups like this, continuing to learn, continuing to grow. You know, like Leah said, you don't have to know everything. You don't know everything. But we all have one thing in common. We all have a story, and we all have to make sure that we share that on different levels. Like I have Crohn's disease, and it took them 3 years to figure that out. So I get that. I know all about it. My insurance, you know, I'm still paying for those different treatments that I have to have. And in terms of breast cancer, I'll have it on the emotional side of it. You know, like I say, I am that voice for those those women who are called our legacies, who are no longer with us anymore. But I'm also that voice for those women who are walking out there who have no clue that they may have breast cancer right now because they don't have that educational knowledge that someone like myself is willing to give them. So I am absolutely honored to be here and to be here amongst all of you. And it's because of women like you that makes me want to work harder to continue what I'm doing. So thank you.
To piggyback off of that, I want to say thank you to those that spoke here today too, as well as the healthcare professionals, because I think doing Zoom meetings and events like this are helping to bridge the gap, right? And helps us understand their side as they understand ours, and we can build a relationship where it's more communicable. So that way we have more trust in the system. So thank you to everyone who has come today, and I look forward to doing more like this and learning more, to be able to come back to my sisters over here. And, you know, I'm part of a other breast cancer groups where you just have little communities, and I can share what I learned with Tigerlily with, you know, this other breast cancer group or the other women that I know. And I think this is just such an important platform, and thank you all for doing this.
Thank you, Aleena and Vera, Diane, Leah, Michael, who was also on earlier. Thank you to everyone who's on this call. Thank you for creating space and holding space for these women and their incredible stories and for the work that they do. And thank you to GRASP, our partner as well, for being allies, working towards this too. We're all working together towards making sure that we end these health disparities and taking action across at every stage. So thank you all so much. Have a wonderful weekend. Happy Women's History Month, Herstory Month / year, because we celebrate ourselves. Pat us on ourselves on our back. Yes, yes, yes. Yes, thank you for the gentlemen as well that are also on this call. We appreciate you. Thank you all so much. Have a great weekend. And yes, stay tuned because we're going to online and we'll have resources. Let's do this. Let's get it. Keeping this energy going. Thanks. Bye.